Before I had Gavin, I didn't know where my life was going. It was kind of, a roller coaster. Didn't know what I wanted to do, who I wanted to be. Then I had him, and he seemed fine. And about 6 weeks, I noticed something just wasn't quite right, like with the eye rolling. I just thought his eyes were, adjusting to this world. They don't see like you and I right away, and noticed something on his back. And again, I thought he was just growing, and it was normal. And by the time he turned 4 months, the eye rolling became more frequent, and the bump wasn't going away, and that's when our journey really started. By 6.5 months, he started crying like 16, 18 hours a day, and at first people thought I was crazy. First time mom, I got told, took him to the ER in Rapids a couple times, and they said, it's a UTI, it's teething, it's a stage. And I was like, a kid doesn't cry for any of those reasons for hours, for weeks. People thought I was crazy.
I first met him when he was 7 months old, when he first admitted in the hospital. Gavin, I would consider one of the patients that has multiple complex medical problem. Is involved many organ systems. So we deal more with the medical part, but how do we get resources? That's when step in Jenny, that help coordinate all of this.
We wanted to be able to do something to help these kids work with their primary care team to help them kind of have a point of contact and kind of pull everything together and just make it easier for the family and the child to get good care. A lot of times with kids that have complex special needs, they have so many providers involved. Everything is kind of pieced out.
My part of the program is kind of connecting families with resources, trying to get involved as early as possible to get them the health insurance coverage they need, to get them all the services, get them on waiting lists, just show them the things they may not be aware are out there, and get them ready to be a part of those programs and get connected with as many community resources as possible.
They're not just like a social worker or a pediatrician, they're family. And for me, that's huge, because when you're feeling so alone and like nobody understands, and you can call them and they can reassure you that you're not alone and that things are going to be okay.
So we find that they get better connected to the appropriate specialists and teams and providers to utilize services less like urgent care, ER, and the hospital. And so that saves healthcare costs and dollars for the family and for the community and for insurance.
It means more than anybody will ever understand. Now going through all the testing, trying to figure out why this is happening, what's causing all these developmental issues, why is he having these seizure-like eye-rolling episodes. This program has been amazing for our family. Without them, I honestly don't think he would be here. I pray that they only get better, and that they can help other families, and that other families will step up and ask and do what I do. Right, buddy?